This presentation will evaluate the Troubled Families Programme and how effective it is in supporting families. Straw 2001 stated, "Societies depend on shared values and shared values are passed on through children. Values won't be passed on from one generation to the next unless they are reinforced by the parent-child relationship. So parenting is a public as well as intensely private act. Hence society's interest in the parent-child relationship. Families are crucial to the survival and development of shared values. This is very important within communities and is a significant reason why the government set up the Troubled Families Programme, as well as fund other agencies to try and support families in difficult times, in the hope that they can improve their lives and this will in turn make a positive impact within communities." The Troubled Family Programme was initially introduced in 2012 after the riots in London. Each local authority was responsible for identifying their assigned troubled families. To help local authorities to identify some of their troubled families, regulations were passed allowing the Department for Work and Pensions to share data on families receiving out-of-work benefits without informed consent. Troubled families were defined as households that are involved in worklessness and financial exclusion, poor school attendance, crime and antisocial behaviour, children who need help, including children in need and children with special educational needs, physical and mental health problems, domestic violence. If families had two of these criteria, they were enrolled onto the programme automatically. Local authorities were to work with an agreed total number of families over a 5-year period. The Prime Minister at the time, David Cameron, pledged to invest £448 million in order to turn around the lives of 120,000 families. The Troubled Families Programme is about the targeted intervention for families with multiple problems, including crime, antisocial behaviour, truancy, unemployment, mental health problems, and more. One aim of the programme is to tackle issues before they require costly interventions. One of the priorities of the programme was working with families with multiple problems who are of most concern and attract the highest reactive cost. The government also hoped to drive wider system change at a local level, including the adoption of a whole family approach and better multi-agency working. Local authorities were also committed to engaging in ongoing service reform. Each local authority must appoint a key worker for each family who coordinates multi-agency support for the family. The key worker works towards agreed goals for every family for all their problems. These goals are shared and jointly owned across local partners such as the police, schools and health professionals. The current programme allows a high level of local discretion and national flexibility. Local areas have the flexibility to identify and prioritise families of greatest local concern and cost and to commission services locally to meet the families' needs. The aims of the programme was to turn around the lives of these families. This would be achieved either when they achieve all three of the educational and crime antisocial behaviour measures, each child in the family has had fewer than 3 fixed exclusions and less than 15% of unauthorised absences in the last 3 school terms, and a 60% reduction in antisocial behaviour across the family in the last 6 months. As well as this, offending rates by minors in the family to reduce by at least 33% in the last 6 months. Worklessness is a problem found in many troubled families, and achieving continuous employment can be transformative. Therefore, a payment by result system was offered if at least one adult in the family has moved out of work benefits and into continuous employment in the last 6 months and sustained of a period of continuous employment. For the first part of the result, where the family members are in receipt of universal credit, the family must satisfy the relevant earnings threshold. Troubled families' employment advisors will provide information about earning thresholds to local authorities. For the second part of the result, the length of time an adult must remain in work depends on the type of benefits they were receiving previously. The government set up this programme with the intention to change the repeating generational patterns of poor parenting, abuse, violence, drug use, antisocial behaviour and crime in most troubled families in the UK. In the past, these families have often been failed by services which have tried to respond to one problem that presented itself, whether it was truancy, domestic violence, antisocial behaviour, or unemployment, but failed because they have been incapable of dealing with many interrelated problems the family is facing. David Cameron stated in his Troubled Family speech in 2011 that last year the state spent an estimated £9 billion on just 120,000 families. In his speech, he also stated that building a stronger society in which more people understand their obligations and more take control over their own lives and actions is necessary, but it is about knowing how to help these people that is crucial. This example from his speech signifies the impact of numerous agencies working with one family and the fact that it caused more mayhem than helped. To emphasize his point, he used an example of a true story about a family in northwest of England. A mother, 3 teenage sons, and a pregnant daughter. In a single year, they were the subject of a quite unbelievable amount of disconnected state activity. The police were called out to their home 58 times, including 5 arrests and 109 hours of police work. Ambulances were called 5 times. There were repeated visits to A&E for things like self-harm. 2 injunctions were issued against tenants. Neighbours kept complaining to the council about disruptive behaviour. 2 children were subject to different sets of close supervision by youth offending teams. There was a summons for non-payment of council tax, and on it went. All of the different arms of government, the endless state schemes and interventions, dealing with individuals almost as if their families were invisible or irrelevant. Educational psychologists would see the children, but wouldn't realise their mother was depressed. The police kept calling, but crimes didn't stop. The housing officials came to collect their rent, but no one paid. And the Job Centre Plus tried to find work, but the teenagers couldn't read. So no one sees the whole family and grips with the whole problem. This case shows how large the social failure was for this family. The intervention is firstly meant to benefit the individual families first. The aims set out in the previous slides demonstrate that it is important to sustain progress for families, as well as to transform the way local services work, and lastly to show that this program makes a difference in cutting costs and savings to the taxpayer. The net impact analysis indicates that the program has had a positive impact on the proportion of looked after children, convictions and custodial sentences, and those claiming job seekers allowance. The results appear realistic in scale given the complexity of the needs of families on the program. The most striking finding is that the program appears to have reduced the proportion of looked after children. 2.5% of the comparison group were looked after compared to 1.7% of the program group, a 32% difference for this cohort at 90 to 24 months after joining the program. The impact on those on the program is likely to have huge benefits to children's lives, contributing to managing children's social care pressures and provide significant savings. This finding is consistent with staff surveys results, where 90% of key workers believe the program is successful in helping families avoid statutory intervention, and 76% of troubled families coordinators, employees coordinating the program in their local area, reported children in need of help and protection as one of their top 3 priorities of the program. Case study research also noted that children's social care services were collaborating with early help teams to reduce the burden on social workers and deliver better outcomes for families. For crimes, the results show that the program reduced the proportion of adults receiving custodial sentences by 1.6% of the comparison group receiving custodial sentences, and compared to 1.2% of the program group, a 25% difference in the 24 months after joining the program. The program design was based on evidence from the first version of the program and from family intervention projects that preceded the Troubled Families program. Although the program is delivered differently in different local authority areas, the program is based on a high-level theory of change, that whole family working, multi-agency working, and intervening earlier and focusing on outcomes and data are more effective in getting families the right interventions at the right time, and therefore improving families' lives and working in a more efficient way. All local programs are required to follow these core principles. Early intervention means spotting problems as early as possible rather than waiting for high cost and reactive services to be required. Families at risk should be identified more proactively. Local services can then provide appropriate support to resolve problems and prevent escalation. Both data and referral systems are used to identify families in need of support. This is facilitated by effective data systems to identify the right families, monitor progress, and inform commissioning. The program has a relentless focus on outcomes. This is demonstrated through the payment by results system. The program operates on the premise that public services have previously failed families who have multiple problems. Services have tended to respond to a problem that individual family members exhibit rather than understanding and tackling underlying root causes of the interconnectedness of other family member problems. Evidence from the evaluation of family intervention projects indicates that the likelihood of successful interventions and sustainability of outcomes increase when practitioners work in a whole family way. Whole family working is facilitated by the key worker. The key worker builds an understanding of all of the interconnected problems and of the family dynamics. This enables them to look at the totality of what's going on and find the root cause of the problem. The key worker adopts a persistent and assertive approach, establishing a relationship with the family and working closely with them to make sure the family resolve their problems. The key worker agrees a single plan with the family and across local services. Interventions are subsequenced and coordinated within this plan to ensure that different services are not contradicting each other. There is also a shared ownership of outcomes as different local agencies have agreed the plan. The key worker adopts a strengths-based approach by recognizing and building on existing strengths in the family. They increase resilience by supporting with parenting, mental health issues, household budgeting, interparental relationships, and other significant issues that should be addressed. They bring in specialist services such as mental health services or depth advice where necessary. For example, families with the most complex barriers to work who are furthest from the job market receive support from the troubled families' employment advisors. The employment advisors are work coaches who are second from Job Centre Plus to work with local programs to provide specialist support. Multi-agency working means strong local strategic partnerships across different agencies. It is a key enabler to achieve family outcomes. This may include multidisciplinary frontline teams who are capable of delivering whole family support to a family irrelevant of their profession. Services are organised around people's needs rather than around agency boundaries. This includes joint commissioning, shared data systems, a common referrals procedure, multidisciplinary triaging, workforce integration, and building a culture of partnership working. The programme facilitates whole system transformation through an upfront annual service grant. For most areas, this amounts to £200,000 a year for local authorities and their partners to invest. The Service Transformation Maturity Model provides practical advice on service transformation by explaining clearly what this means, how it can be developed, and how to measure and monitor progress. Local authorities are required to complete a Service Transformation Maturity Model self-assessment and develop plans for improvement as a result. An independent evaluation of Phase 1 of the Troubled Families Programme was commissioned by the Department for the Communities and Local Government. The three main elements to the evaluation were a process evaluation involving qualitative research with 20 case study local authorities, tracked over 3 years. Telephone interviews were conducted with a further 50 troubled families coordinators to explore any variation in the local troubled families programme delivery models operating outside of the case study areas. The process evaluation also included a parallel set of qualitative interviews with 22 families interviewed towards the start of their intervention and at an interval of 12 to 18 months later, as well as surveys for staff and an economic review of the programme. As demonstrated in this presentation, there are many factors from the programme that cannot be assessed just on the points mentioned here. For example, the comparison between the first phase of the programme and the second. This programme is in-depth and there have been many numerous reports from the government as well as independent organisations in order to provide a summary of the results. The complexity of being able to fully summarise work on this large scale is that there are many aspects to consider, especially as results depend on the families and it takes years for the families to end their programme. There is no doubt that the Troubled Families Programme has aimed to resolve issues of previous interventions that were simply not working, and to some degree it has made many positive changes, such as agencies working better together, but whether it has been as financially beneficial as suggested is not as clear.